sponsors. Live from the 92.7 studios in the center of Cayman's capital, Georgetown. This is Straight Talk. Let's get to the point.
Good afternoon and welcome to Straight Talk Drive at 5. I hope everybody's doing okay today. It is Medical Mondays brought to you by Health City. And so we are here with good people from the East. Always excited about hearing from them. Want to just welcome everybody into Monday. I know the weekend was so nice. It was tough to come on back to the weekday again. Hope you guys had a good time, and just your Monday started off good. You're in traffic, headed home, so that's always a good thing, right? So anyway, this Monday, I wanted to talk just a little bit about pancreatic cancer. And so, of course, we're going to just go ahead. I'll welcome who is in the studio with me and who's going to be a guest on the show. Of course, we have Shomari Scott, who is the Chief Business Officer over at Health City. Hi, Shomari.
Hello, how are you doing? Great to be here again.
Missed you last week, but you arrived.
Yes. So I gave you a little fib and I told you I'd be back the week after. But there was a meeting that got in the way, but that's okay. Tiffany came and I heard she did an absolutely fabulous job.
She absolutely did. She always does. So
Yes.
yeah, it was good to see her on that front. I'm accustomed to her. We go way back.
Ah,
the chamber days.
oh, right.
Absolutely. Yeah. So that was Shomari. And then we also have Dr. Deepak Varma, and he is a senior consultant at Health City, Cayman Islands. And we'll talk a little bit more to him. He's actually joining us via the stream link. So good afternoon and welcome, Dr. Deepak.
Good afternoon. Thank you very much. It has been a good Monday today. Good way to start the week.
Definitely. Good stuff. And of course, we have the lady herself, Miss Jennifer Weber, Operations Manager from the Cayman Islands Cancer Society.
Hi there. So happy to be back on again. Appreciate Health City inviting us on to be a guest once again.
Absolutely. And we always love when Miss Jennifer's in the house because we're going to get a lot of information. I love that. You make my job easier.
Well, good. That's good.
Yeah.
Hopefully it'll make it easier for the listening audience to better understand their health and what to watch for and to be able to keep themselves healthy. It's a good thing if they don't come see me, right? So we want everyone to stay healthy so they go, Jennifer who? And they never have to come and see me.
Oh, wow. Now there you go. That's a thing.
That'd be good.
That should be a thing, right? Absolutely. So yeah, for sure. So today we're talking about pancreatic cancer, right? I'm going to read just a little bit about Dr. Deepak just to let the listening audience kind of know, what he does all the way down in the east, there, right? That lovely drive coming into town. And you're right now you're at Health City, correct?
Yeah, I'm in Health City. I'm in my office.
Okay. All right. So Dr. Deepak joined in 2019 with more than 20 years experience in managing complex gastrointestinal surgical disease. Dr. Varma has been trained at medical institutes in Europe, Hong Kong, South Korea, and India. And he's an expert in laparoscopic colorectal surgery, minimally invasive GI surgery, upper GI, pancreatic cancers, hepatopancreatal-biliary surgery, liver transplant, and coloproctology. And I know Shomari does that just so I can sound like I'm...
No, man, you did well. You did very well.
Thank you. So that's a lot. Dr. Deepak. So tell us a little bit about what is it that you focus on?
Yeah. My main focus has been for the past many years has been on most of its laparoscopic surgeries for GI diseases, for malignancies, and I have been trained in liver transplant. I used to be in the transplant unit for a few years back in India, but for last few years, 4 5 years, I have not been into transplant. I have been more into minimally invasive surgery, laparoscopic surgeries for in the gastrointestinal tract. So especially today's subject is pancreatic cancer, which I am quite interested in and have some experience in managing patients with pancreatic cancers.
Okay. All right. And so, yeah, Shomari, I normally, have you started off. So tell us a little bit about some of the services that we're seeing at Health City, and we can get more into the conversation.
Definitely. Well, the reason we wanted to come on today just to speak about pancreatic cancer is because during this month, usually we cover a lot of various cancers throughout the year. Or what you may need to do in order that if we can, as best as possible, actually catch this earlier, because this is one of the cancers that the survival rates are not the best. So that's why it's very important to make sure you're in tune with your body so that you can catch this specific cancer early in order to try and give you the best outcomes. And it's always a pleasure to be here with Jen from Cancer Society, just because she's a great partner. She does great for the Cancer Society in regards to making sure that persons are armed with all of the information that they need. And it's just great to be able to get the information out there so that people, as once again, can be armed and move forward and take best care of their actual. A young gentleman who actually ended up having laceration to his liver. And Dr. Deepak actually was the only physician on island that would have been able to save the young man's life. He wouldn't have made it to Miami. And, as fate had it, he arrived 1 month prior to this actually occurring.
Wow.
And when it comes to the pancreas as well, Dr. Deepak is one of the few physicians in the Caribbean that will be able to actually perform procedures on the pancreas as well. So every time we talk about the different physicians we bring, we always bring the A team. And Dr. Deepak is a great addition, and he's been here for over a year now, and has helped the quality of life for many individuals, as well as helped to save a lot of lives as well. And we're just happy that he'll be able to give us some insights in regards to pancreatic cancer today.
All right. All right. Shamari, I'm accustomed to you coming, from the East and bragging, but I like it. I like it because that means that, you're talking about the A team, but that means that that's what we have in Cayman. And that's incredible, right? Because the better service that we can provide on island is amazing.
Definitely.
It really is.
And as I will always say that, especially based on being in tourism previously and traveling to other Caribbean islands and other tourism destinations in the region and a little bit stretched outside of the region, I always got to see, obviously, the best hotels. And that's the impression you have of the various countries. And you understand that our product is great and their product is great. But when you really get to understand healthcare and how great of a system we have here outside of Health City, is when I actually have to go and see other hospitals, other clinics, and then you get a true appreciation of the HSA, of all of the private practitioners that we have on island. Health City only helps to enhance what's already here and what's a great healthcare system. And we're always looking to fill more gaps. And as best as possible, yes, I come from the East and I'm bragging about what we have there. But as a healthcare network within the Cayman Islands, I think we can brag in totality in regards to the medical services that we have. And it's once again just a pleasure to be here with another great partner. We have many great partners across the Cayman Islands that really just want people to be as healthy as possible. And this is, one of the situations in which we're just trying to educate.
Yeah. Well, working together, I mean that's just the point, right? If we're stronger together.
Definitely,
So
100%.
yeah, and so let's just bring Miss Jennifer Weber into the conversation. So you're in a lot of conversations, but especially for this month, like
Every report card I ever got from school said talks too much in class, destined to be a talk show host. So yeah, I talk
you're
a
on
lot.
your way.
I talk a lot, but there's a lot to talk about. There's a lot of good information out there, and when doctors are willing to share this information, and health systems are ready to help get the information out to the people, it's a good thing. So I'm going to turn up every time I'm invited.
Good stuff. So tell us a little bit about what it is that you do. Just remind the listeners of what you do, and how they can get in contact with you if they need anything.
Sure. So the big thing in essence that the Cancer Society does is the Cancer Society makes it possible for patients to gain access to the treatment that they need. So the Cancer Society is not providing medical advice. The Cancer Society, you can't call me up and say, hey, who's the best oncologist on island? Because what I'll say is what's true, which is they're all well qualified. The best doctor for you depends on what kind of patient you are, and your insurance and those kinds of things. But we have, so we're always providing access, which means that we're helping with the insurance. If people don't have insurance, we're helping to get them insurance. We're helping to advocate with government for those who might qualify for some special services through government, for like the Sinico indigent coverage and things like that through the needs assessment unit, and making it so that people get what they need according to what their doctor recommends.
Okay. All right. Great. Now, Dr. Deepak, talk to us a little bit about just pancreatic cancer, just on a whole.
Yeah. To begin with, I would like to just brief about pancreas. What pancreas, the function of the pancreas, and where it is located. Pancreas is a very important organ in the digestive system. It helps to digest macronutrients like fat, protein, as well as carbohydrate. And also it has got specialized cells which produce insulin and glucagon, which help in balancing the blood sugar levels in the blood. So it is a very important organ which plays a central role in digestion as well as in the metabolism of human body. So that is pancreas. Coming to the position or the location of the pancreas, it lies behind the stomach. We have the abdominal cavity, and it is one of the posterior most, that is organs in the abdominal cavity. It is almost close to the a relatively inaccessible organ. So previous, especially in historically, if you speak, the diagnosis of pancreatic diseases as well as the treatment of pancreatic diseases were very difficult. But now we have good imaging modalities like CT scan, ultrasound scan, MRI scan, and a lot of imaging which can detect pancreatic diseases reasonably early compared to probably 15-20 years back. So, and pancreatic cancer generally is supposed to be a dismal cancer. It's not, the prognosis or the results of treatment are not very good because it is diagnosed late. It is not diagnosed early enough to give a cure. But so the key point for good results for treatment for pancreatic cancer is to pick it up early. So that probably we would focus how and with what kind of patients or what kind of population we should be trying to pick up pancreatic cancer early.
Okay. And so what are some of the symptoms of, somebody suffering possibly with pancreatic cancer?
Mhm. Generally the pancreatic cancer, the symptoms are very subtle. It's not overt at all, and the most common or most important symptom would be loss of appetite and loss of weight without any reason. Many people attribute what happens, especially say if you are an obese person, you try to get rid of your weight. That is intentional weight loss. So that should be separated from a weight loss which is unintentional. So if it is an unintentional weight loss along with loss of appetite, the first suspicion should be pancreatic cancer. The incidence of pancreatic cancer in the society is not very high, but as this is a serious disease, and if we don't pick it up early, the treatment results are so poor that the index of suspicion should be very high if a person develops one of these symptoms.
Okay, so I saw also online a couple of symptoms. Maybe you can correct me if I'm kind of off guard. Would a you said a loss of appetite or unintended weight loss? Would any abdominal pain occur as well?
Yeah, it can. Abdominal pain generally is a late symptom of pancreatic cancer. It's not an
Oh,
early symptom, because if a person develops a large mass in the pancreas, he or she can have pain. Another symptom which is very common is obstructive jaundice. That is, the person sees his urine is high colored, or his eyes are yellow, skin becoming turning yellow, and they might have itching. Itching is a very common symptom of pancreatic cancer, which affects the head of the pancreas. Head of the pancreas is the part of the pancreas closer to the small bowel, through which the common bile duct, that is the channel through the bile, flows into the small intestine. So if there is a mass lesion there, if there is a cancer sitting there, it will block the bile duct, and this will cause jaundice. This is different from jaundice caused by liver diseases like hepatitis or hepatitis A, B, C. This is an obstructive jaundice. This jaundice is caused because of the obstruction to the outflow of the bile. So it is different from a liver-related jaundice. So that's why itching is a very important symptom in obstructive jaundice, especially in pancreatic cancer.
okay. And obviously we're always just advising people to just be on top of their health care and how they're feeling and be in tune with themselves. Shamari, of course, we talk about this every Monday, Medical Monday, that's brought to you by Health City. Just talking about, if something's happening in your body, to not ignore it, to just ensure that you're taking care of yourself, so that it doesn't get to a point where it's kind of beyond control, or where you could have helped yourself better had you caught something earlier.
Definitely. And, more and more, especially being involved in healthcare before I was in tourism, and being a typical man, I would think that if there's something there, just, ignore it and it'll get better until you finally can't, and then you'll go and deal with it. But being involved in healthcare, one thing that is, well, it shouldn't have been surprising to me, but it actually is that the earlier you catch things, the more you pay attention, the better the outcome will be. And at times you can actually help save yourself or save a loved one. And, we just think about what's meant to be is meant to be, and what's going to happen is going to happen. But with all of the advances in healthcare, things caught early, for the most part, you can actually deal with it and then continue living a productive life. But for the most part, you need to catch it early. And the only way you're going to catch it early is if you have constant checkups. And Jen has a nice analogy that you will give in regards to, the insurance plans and how you go about as a female in one instance, going ahead and making sure that you're taking advantage of your benefits, even if they're limited, to be checked. But for the most part, as many checks as you can do once a year, once every 2 years, that's definitely going to help, as well as eating healthy, exercising, paying attention to your body. You know best when your body doesn't feel right. And taking care of that quickly and early will always help you to get better outcomes.
Right. So tell us a little bit about that, Ms.
You know,
Jen.
as I was listening to Shomari just now, I was thinking about how sometimes we have patients who come in, and of course, whenever someone gets diagnosed with cancer, they're often shocked, right? But well, sometimes what people say is confusing, because they'll come in and they'll say, "I can't believe I have cancer. I was just at the doctor the other day for a cold, and they didn't tell me I had cancer." I think people feel like doctors have some sort of x-ray vision where they can just like look at someone and like it'll light up if they have cancer, or if they get an x-ray, something will light up. Or they get a blood test. They might just be getting their cholesterol checked, but they feel like cancer should show up in the blood test. Well, things that show up are things that we're looking for. And so it's so important to have your annual checkups, your annual screenings. And unfortunately, there isn't a screening for all cancers. You can't just get a blood test that tells you if you have cancer anywhere in your body. And so there are lots of things that you can do to try to help reduce your risk of developing cancer. But also there are a lot of things you can do in terms of screening tests to see if you have cancer, and you can catch it early. Early detection saves lives. So for example, simple explanation is mammograms. You get a mammogram every other year after the age of 40, because you're screening for breast cancer. And some women say, they used to say, I don't want to get it because I don't want to know if I have cancer, because I don't want to do the chemo. Well, if you find it early, you probably won't have to do the chemo, because they can just remove it. And if it's early enough, you don't have to do the chemo, you don't have to do the radiation, you can take care of it and then go on with your life. Same thing with a pap test. Women say, I hate to get the pap test, and none of us like it. Nobody wakes up in the morning and goes, woohoo, it's my pap test day, yahoo. But we have to do it, right? Every other year we do that. We stare at the ceiling. Okay, it lasts a couple of minutes. But if we do that, then the doctor can catch precancerous cells before they turn into cervical cancer.
Right.
That's huge.
Right.
Same thing with screening for skin cancer. You get all those suspicious moles checked periodically, depending on what your doctor recommends. And, then you can rest assured that, the doctor has an idea of which things to watch out for and which things aren't really of concern. And there are a lot of different screening tests like that. There's a mouth cancer screening test you can get from your dentist. There's a throat cancer screening test you can get from your ears, nose, and throat specialist. But there isn't a cancer check for everything. So overall, we have to be connected to our GP. Make sure we get our regular checkups, because it's the little things like suddenly getting jaundice or losing weight, or those little things that will come out in a discussion with a doctor who knows you, will be good indications for what the doctor needs to know if there's something that's changing.
Okay, great. The thing is, that's such a great information. And today we're talking about pancreatic cancer. And you are listening. You just were listening to the voice of Jennifer Weber from the Cancer Society, as well as we have Shomari Scott from Health City, and Dr. Deepak Varma, who's also from Health City, and just talking about pancreatic cancer today. When we come back, we're going to take a break in a little bit, but when we come back, I wanted to talk a little bit more, Dr. Deepak, about some of the risk factors, and I really want to talk about what is the pancreas. Right? What does it do? Like, what does it really do? I think sometimes there are all these little things going on in our body. They're just regulating all this stuff. And if something goes wrong, it's like, well, what does that do? And it's like, I'm reading about it. It's this little thing, this little pear-shaped thing, and it's like, yeah, it's pretty important, right? And so some things, like Jennifer, you were just talking about, can be cut out, and okay, you catch it in time, it's gone. But this is not one of those things, right? And so it's pretty important. I'm also
Yeah.
kind of, understanding that it's harder to detect, because generally it's not until the late stages that you actually start with, to see the effect that it's having on the other organs in your body. Is that correct?
Yeah.
Yeah. So therein lies the problem. So early detection is definitely something that you want to look for. So some of the symptoms that we're needing to pay attention to. Quickly before the break, though, Dr. Deepak, are there particular people that are at risk for this?
Yeah. Yes. If you have a very close family member with pancreatic cancer, you are at high risk for pancreatic cancer. If you are a smoker, if you have the history of alcohol abuse, obesity, all these are factors which can increase the risk of pancreatic cancer. And there are certain conditions, like genetic conditions, like certain development of polyps all throughout your intestines, both in the large intestine as well as small intestine. There are certain syndromes. There are certain conditions like hereditary pancreatitis, that in which you get recurrent attacks of inflammation of the pancreas, and these are all high risk people for pancreatic cancer. So the target population for screening pancreatic cancer would be somebody who falls into this group of patients.
Okay, great. And that's good information. The risk factors, as you just heard, smoking, there's genetic factors, family history, obesity. So a couple of things to just really pay attention to your body. We will come back and continue the conversation. This is Medical Mondays, and we're talking to the good folk from Health City, Shomari Scott, who's the Chief Business Officer, as well as Dr. Deepak Varma, who's the Senior Consultant over at Health City, and Miss Jennifer Weber, who is the woman in charge of the Cancer Society, the Cayman Islands Cancer Society. Yeah, she's the woman in charge. She's in charge of whatever room she enters. So
very true. Very true.
We know that.
I agree.
So,
I concur.
Yeah, thank you, Shomari. I'm glad I got some reinforcement here. So we'll be back with more. So stay tuned for more Straight Talk Drive at 5.
I think it's so interesting.
Thursday through Monday. Find the sale at Bayshore Mall and Cardinal Avenue, or enjoy late night shopping at the Strand until 9 p.m. Get unbeatable discounts from brands including Roberto Coin, Swarovski, Bulgari, Masica, Tubbs, Ippolita, Lagos, Fossil, and many more. Plus, take an additional 10% off all non-branded sale merchandise. It's Black Friday all weekend at Kirk Freeport. Visit kirkfreeport.com for full details.
Cayman National's new suite of deposit accounts is something just right for you. Are you an easy banker that loves flexibility, or a legacy builder saving towards that dream goal? You might be looking for a Gen Now experience, perfect for the youth, or maybe it's time to enjoy the Caymanite lifestyle with peace of mind. Visit caymannational.com or stop by one of our customer service centers to find out more about our new account offerings. Cayman National, banking that fits your lifestyle.
And so you see, I, the Burger King, received this tape to play with important instructions. I'm about to play it again. Let's turn it up.
Good luck on your mission. This message will self-destruct in 5 seconds.
What was that he said about something impossible?
The King has completed one of his toughest missions yet and brought the Impossible Whopper to Cayman. The Impossible Whopper, just like the regular Whopper, but made from plants. Brand new on island and only at Burger King. 7 Mile Beach, Waterfront, Walker's Road, and Red Bay.
Helping out each other, family and everybody. It's a simple act of kindness with you, me, and and RBC.
RBC wants to spread acts of kindness during this festive season. One simple act of kindness for our friends, co-workers, and communities can cause the brightest smile. Help a stranger, give a food basket, or call an elderly person. Share your stories at facebook.com/RBC Caribbean.
Acts of kindness, RBC.
Welcome back to Straight Talk on Star 927.
And welcome back to Straight Talk. This is Medical Mondays, and you are tuned in listening to Health City. It's brought to you by Health City every Medical Monday, and we are talking to Shomari Scott, the Chief Business Officer, as well as Dr. Deepak Varma and Jennifer Weber, the Operations Manager from the Cayman Islands Cancer Society. This is Drive at 5, and I hope you're enjoying the conversation, just getting to know some more information. Today, we're talking primarily about pancreatic cancer, and that is one of the cancers that's almost like a mystery in a way. Yeah, you would agree with that, Dr. Deepak?
Yes. You were just before we left for the break, you were asking about what is pancreas and what does it do and what is the function. As I started early in the beginning, pancreas is an organ which helps in digestion. It produces some enzymes, strong enzymes, which digest the main nutrients which we eat. It also produces blood sugar regulating hormones. That means these hormones are released into the blood, and depending on the blood sugar levels in your body, the hormone levels are adjusted. So pancreas is a very important organ within the human body metabolism. So the removal of pancreas is definitely has got some side effects, but if you can live without pancreas also, even if you remove the entire pancreas, you can replace with insulin, replace with enzymes. You can live without pancreas, but you will have to be on lifelong medications. So pancreas is a very important organ in the body.
Okay, well, that's good information. Definitely that, I'm not sure if a lot of people knew that. Let's talk a little bit about some complications. When your pancreatic cancer kind of progresses, what are some of the complications that it does cause? You did mention that extreme weight loss is one of the kind of indicators, right? But in terms of having pancreatic cancer, that's also one of the results. Is that correct?
Yes, pancreas is, we can visualize pancreas similar to an animal, like it has got a head, body, and tail. So depending on which part of the pancreas is affected by the cancer, the symptoms differ in each individual. If it is near the tail of the pancreas, or if it is in the body of the pancreas, the symptoms are very, very subtle, and usually it is diagnosed very late, and the cancer is very much advanced. Many times it is beyond effective treatment. But if it is in the head of the pancreas, as I told earlier, if it is close to the bile duct, then patients present early with jaundice, and that is a relatively better, which gives a relatively better prognosis. But overall, the pancreatic cancer treatment does not have a very good prognosis. It is probably a leading cause of death after probably in 4th or 5th leading cause of death in the world. So.
Oh, wow. Okay. Now, let me ask you. I know we're talking about it not kind of being detected until it's far gone, you're far on in it. But are there any tests that you can take that will, that can check to see if your pancreas is okay?
Yes, many patients, as Jennifer was mentioning earlier, many patients come to us, tell, I was fine yesterday and I went to my doctor, but they could not detect this. Today you are telling that I am having cancer. So do we have a test which can detect all the cancers? No, That is the problem with many cancers. So we have some screening tests for like breast cancer. We can have mammogram. Colon cancer, we can have colonoscopies every 5 to 7 years or sometimes 10 years. But for pancreatic cancer, the subtle symptoms should be picked up early and investigated. So the suspicion or the index of suspicion to diagnose pancreatic cancer should be very high. If you see a person probably in late 60s who come with unintentional weight loss or loss of appetite, first think about pancreatic cancer. Or the second would be a gastric cancer, because usually colon cancer or other cancers will not cause symptoms of loss of appetite and loss of weight unless it is so much advanced. So the first, even these mild or subtle symptoms should be taken seriously. You can do an ultrasound scan and see, especially do a fasting ultrasound scan and try to see the entire pancreas. If you are not able to see the entire pancreas, because ultrasound has got its own limitations, especially it's not a good investigation to do in an obese person. The ultrasound scan will not give you good information. So if your doubt is still high, go for a CT scan. So a CT scan can detect pancreatic masses from probably 1.5 centimeters or so. And we have another good modality, MRI scan. MRI scan is a good modality for pancreas, which will detect smaller pancreatic cancer lesions as well as pancreatic cysts. Or there are precancerous lesions in pancreas, something like what we call intrapapillary mucinous neoplasm. That means they produce mucin, which is a secretion from the pancreatic cells. They can form cyst-like lesions in the pancreas. These are all lesions which can be picked up, and if at all, if it is developing into cancer, we can pick it up early. And another very useful modality is something called endoscopic ultrasound. Because the problem with the usual ultrasound is that it will not penetrate deep beyond a certain distance. But the endoscopic ultrasound especially is a very good modality to detect early pancreatic tumors. Only disadvantage of endoscopic ultrasound is that it is an intervention. That means you are doing an endoscopy on a person. So you should select those persons who should undergo this endoscopic ultrasound. But you can you can see the entire pancreas, probably half a centimeter away from the pancreas, and you can pick up even very small pancreatic tumors. So in high risk group, the usual protocol is to screen them with regular MRI and add endoscopic ultrasound if you have a doubt. So both these are complementary, and it will give you it is a very sensitive investigations to detect early pancreatic cancer.
Okay, so Dr. Deepak, what are you busy with generally? Like, what are some of the things that you're seeing more often that keep you busy over at Health City?
Here, talking about cancer, more common cancer would be colonic cancers, large intestine cancers. Pancreatic cancers are relatively rare. We don't have any registry. I was thinking, we were having a chat in the morning and was thinking about a registry is important to know the incidence of cancer as well as what type of cancer is prevalent, and then only we'll be able to know. We'll be educated to general public will be educated. We will be educated to screen and to look for what kind of cancer is more prevalent in this population. And it's not very difficult to maintain a registry with because we are not having a very big population at all.
Right.
So we should definitely think about a cancer registry on our island. I think Jennifer will definitely agree with my opinion.
You can't see me, but we're nodding so much right now
He
in
can see
agreement
you.
with you. Oh, can you?
He can see you. Yeah.
Okay. So yes, we agree 100%. You know, currently in the Cayman Islands, we have what's called a voluntary registry. And a voluntary registry means that the patient themselves, the person who had the cancer, has to voluntarily come forward and sign paperwork with the cancer registrar. And it's a quick process. It only takes 2 or 3 minutes. It's not difficult, but it's nothing that people wake up in the morning and feel like, what do I have to do today? I think I'd like to fill out a form.
Well, I'll tell you what, it sounded like Dr. Deepak was giving you another job.
Well, no, we have in the Cayman Islands, we have a cancer registrar. That's the noun for the person who takes care of a cancer registry.
Right.
And so she has full-time job doing that.
Okay.
But currently what she spends a lot of her time doing is chasing up people to get them in the registry, as opposed to spending all her time analyzing data. So currently there are a little over 500 people who are on the registry. Now that's not bad, but if anyone listening has ever studied any kind of statistics, that's not a very large group. And we don't know if that group is really representative of our population, because in order for the people to come and be registered, they have to be the kind of people who are open to hearing it. And so, for example, the number one cancer that's in the cancer registry is breast cancer. Well, we don't know if it's really the number one cancer in the Cayman Islands, but we know that the group of people who are most likely to get together and stay together and be friends for life and take cruises and have support groups are breast cancer patients. You never hear about men who have colon cancer going on cruises and wearing blue together and all of that kind of stuff, right? Women who have breast cancer tend to assemble. And so since they get together in groups, it makes it possible for the cancer registrar to go and talk with them, and then the groups of people will go ahead and register. And so we don't have groups of people who have pancreatic cancer, so we don't end up getting those people. I'm saying the registrar doesn't have a chance to get those people registered.
Because you're not the registrar.
No. So the registrar, she couldn't look any more different than me. She's very slim. She's very tall. She has blue eyes and blonde hair. Her name is Amanda. And if anybody, I could give you her number, but I think it's easier that if anybody wants to reach the cancer registrar, just call the Cancer Society and we'll put you in touch. Her office is a little bit difficult to find and it's hard to remember a telephone number when you're driving. But if you need to get involved with the cancer registry, just let us know and we're happy to put you in touch. The other thing you can do is you can go on the Cancer Society website and download the form. You can take a look at it. If you're a little nervous, like what are they going to ask me about? You can download the form. You can take a look at it. It's basic information and it's usually stuff, where you live, what your name is, and just the basics about your diagnosis. But in other countries, they have what's called a mandatory registry, which means that if you go to the doctor and the doctor diagnoses you with cancer, after you leave, the doctor makes a hash mark, 32-year-old man diagnosed with gallbladder cancer or whatever, pancreatic cancer, 1. And that's it. That goes into the registry. And then there's data available so that the community can plan for what's necessary for the future and make guidelines based on what makes sense for that community. So at this point, we have some data, not enough, but we're working towards that. And hopefully in the next couple of years, we'll have a mandatory registry.
Well, that's not kind of makes sense. It feels like it makes sense. It's, definitely something that I imagine it's better for the community because the community can be served and just the knowledge of it so that you're aware of your statistics. Because if your focus needs to be in this area, but you don't have enough information about that area, how can you be focused in that area?
Right.
It just makes sense.
Yeah. And the people understand, the people want it. We talk to people all the time and people call me constantly and say, hey, my friend said that we have more cancer than anyone else. Is that true? And it's the same answer every day. The fact is we don't know. Without the data, we cannot say specifically. But if we had the data, there's lots of good things we could do. We could revise the guidelines for medical tests to make sense specifically for Cayman.
Right. Yeah. And I mean, it's true because we're always hearing about someone that we know
Mhm.
has cancer, and it feels like it's so much, but it's because the place is so small.
Right. And the other thing is, we kind of alluded to this before, is that, when you're looking for something, you find it. So the Lions Club of Tropical Gardens and the Cancer Society and the Breast Cancer Foundation have been offering mammogram vouchers for a long time. And so what are you most likely to find? Breast cancer, because we're looking for it for a long time through the voucher program.
Right.
And then cervical cancer because of PAP voucher programs, and then mouth cancer, throat cancer, skin cancer. As all these screening tests become available, we're more likely to find those kinds of cancers because we're literally looking for them.
Right. So tell us, are there still free PSA through the year as well?
Absolutely. So this is still the month of November, right? Yeah. So this is the month when men are growing their mustache, and it's Men's Cancer Awareness in the Cayman Islands. And so the vouchers are, they were available last Thursday. We had a big event at the Lions Center, and we had over 200 guys show up. We did over 182 PSA tests, which is great. But they are available throughout the year. If you wonder, what do they do with the money that they raise from growing all those mustaches and getting those pledges and all that fundraising? We're paying for PSA tests throughout the year. So any man can come in anytime and request a voucher
from you,
from the Cancer Society. They fill out a form. We give them the voucher. They go get their PSA test. And usually within a day or so, they'll get the results back.
Okay. And so they can do the same thing for cervical vouchers as well as mammograms.
I think Shomari will enjoy seeing me do the gestures. So for in insurance, everybody, even if it's a basic SHIC plan, the Standard Health Insurance Coverage, SHIC, the SHIC plan, everybody has, as a minimum by law, a wellness benefit, and that wellness benefit is about $200. So that $200 is great because it allows you, women in particular, to be able to use that to get a mammogram or a pap test. Now, $200 isn't enough to do both. But the good thing is that those tests are indicated every other year. Right. And so if you alternate, you can do those tests to keep you well every year. And an easy way to remember that is, on you have two breasts, so that's an even number year.
It's coming, Shomari.
It's an even number year. And so on even number years, you get your mammogram. On odd numbered years, you get your pap test. And it's an easy easy way to remember. Men can use that same wellness benefit to get their PSA test, but that's sort of 2.0. For men, we're just trying to get them to get the PSA test, so we just tell them to come in. We'll give you a voucher.
Right. Okay. All right. Great. And so, what? Just because you mentioned it, what is the general cost of a mammogram? Then you're saying 200 can cover it?
Yeah. So there are different kinds of mammograms, but a basic mammogram screening. A screening is different than a diagnostic test. And it's different cost as well. So the screening test is about $200, and it depends on where you go. There's several mammogram machines in the Cayman Islands, and different people have different prices and different machines. But that's about $200. And the diagnostic one, which uses all the bells and whistles that are available with these new machines, is more like $500.
Okay. All right. Okay. Great. Well, yeah. Just wanted to quickly get some information about that. And Shomari, all that stuff's available at Health City as well.
Well, not the mammogram. So we have our oncology offerings that we're building out into the future, when we'll have radiotherapy as well, only within the Cayman Islands, and as well as coming as comprehensive as possible, one of the best in the Caribbean, if not the most comprehensive in the Caribbean when we're finished. That being said, as I mentioned previously, because we have such great service throughout the Cayman Islands, the mammograms and such are available on island, and Jen knows exactly where they are. So anybody who needs, come in to Jen and she will hook you up when the time is right. Mm-hmm. But just to state that we at Health City are just happy to be a part of the medical community, and we have obviously great physicians as well. And if there's any ailment that you think you may have, or if you just don't feel well and you need to come in, the great thing about Health City is that if you have insurance and you are, and it is outlined that you have to pay copay, the most you'll pay is $32 US right? We speak only in US in regards to our charges up there, as well as if you needed a consultation and you're paying out of pocket because you didn't have insurance or you didn't want to use your insurance, the most you will pay is 160 US. And we always work with whomever, depending on their situation.
Okay.
So that isn't something that people have to worry about.
All right, great. That's awesome. That's good to know. You're listening to Medical Mondays, and we're talking to Health City, the good folks from Health City. That was Shomari Scott's voice. He is the Chief Business Officer over at Health City. And you just heard Jennifer Weber, who's the Operations Manager at the Cayman Islands Cancer Society. And we're also talking to Dr. Deepak Varma, who is a senior consultant at Health City in Cayman. He joined us in 2019 and seems right on time. He joined us because of what he was faced with within a month. So thank you so much for that. I mean, I can just be appreciative that we have this type of health care in the Cayman Islands. I'm so happy about that. Just proud of us.
Mhm.
We've come a long way, baby. And they're very, very happy. You know where that came from, right?
Mhm.
Did you? Yeah. Okay. So she's American. She would
Yes,
know,
she would know.
right? Dr. Deepak, some prevention things for pancreatic cancer.
One important thing I would like to emphasize is that when we historically, if you see how the treatment of cancer has evolved, the results of treatment or the results of cancer management has become better not after the diagnosis. It is how you catch early and how to prevent it. That is going to revolutionize the society, and that's how we can go forward. But we can't screen for all cancers. We have some limitations. So especially in cancers which affect pancreas or liver, such organs, we should be the index of suspicion should be very high, and you should be very proactive in investigating those patients with suspicion or suspicious symptoms. Don't wait till the symptoms are full blown. Don't wait till the person develops pain. So if you have a small doubt that your system is a little different for the past 2-3 months, I'm not feeling the same as before. My tummy is not probably not working well. So all these small subtle changes, the best person to perceive and highlight it is yourself, not another person. So even if you have a very small change in your system, then immediately report to your family physician and report each and every probably the silliest symptom you have, because that the family physician is going to pick it up. So don't try to conceal your symptoms, thinking that this is not important, this symptom is not important. Each and every small change in your system should be reported, and that itself will help you detect early cancers, and that is going to change the results of treatment. Not that you find a cancer and remove the cancer. Once you find a cancer and remove the cancer, you have already become a patient. If you have not found a cancer, and if you are screened, and if it is a very early tumor which can be removed with a small safety pin, you can definitely save a tumor to be removed with a shower. So that should be the approach with pancreatic cancer, I think.
Okay. Would you suggest also if the person smokes, they stop smoking? Obviously, the healthy diet is very important, just all around, right? For anything, just
obviously smoking and alcohol abuse, overweight, all these things are the modifiable risk factors. If you are born in a family with cancer, that is not your fault. But if you get environmental factors which can be modified and which you are abusing it, then you are actually inviting cancer to your body. So that definitely should be smoking and alcohol abuse. All these things should definitely be stopped, no doubt. Any doctor would advise that.
And that's just to maintain just your healthy self, right? Just overall. Yeah.
It's, for example, if it is smoking, it's not only pancreatic cancer. It affects almost every organ of the body. It can affect your heart. It can affect your lung. It can affect your kidneys. It can affect your mucous, oral means mouth, ear, nose, sinuses, so many places. So it's not, definitely it's not a healthy habit.
All right. So yeah, definitely. I've been talking a lot about just healthy eating after, coming from Health City with my executive check that Shomari loves to talk about. And he loves the fact that I did it. So I'm just,
Nice.
and I'm excited about that too. Just, a friend of mine had done it and she said, you need to go, and, she ended up losing a lot of weight. And me, my concern wasn't weight so much as just wanting to know what's going on with me and, just check everything out. So that was really good. And just leaving from there and then speaking to Miss Stellary.
Yeah, so there was some miscommunication, and poor Catherine was telling me that I can't believe I'm off of rice, and then Stellary, who is our dietitian, came up here and actually said, no, it's the portion size, and
well, I'll tell you how it really went.
Yes.
So how it really went was Shomari and I were talking about rice, and I said, well, I'm off it, and he says, why? And so now Stellary then had to correct herself, because Stellary was telling me, like, if you don't have to eat rice, don't eat rice.
Yeah.
But I mean, I'm Caymanian. I don't eat rice.
Yeah.
So I was just like, oh gosh, I'm not eating rice. And Shomari was like, no. You can, because Shomari, he's in on every doctor conversation. He has a medical degree. There's something going on with him. Trust me. Those scholars, Jennifer. And so he kind of helped the situation. And so she was very clear then that, in the little styrofoam, the smaller container, in the smaller portion, those are the rice and the meat, and the big one is vegetables.
Yeah.
So I said, oh, I can actually eat rice.
Yes.
Thank you.
Yes.
So, but since I had started the whole not really,
you got used to it and you felt better, and
I think I just feel better about being better.
Yes.
How about that?
Definitely.
How about that? Dr. Deepak, you like that?
Yeah.
Feel better about being better?
Mm.
It's good, right?
and drink a lot of water.
Yeah, and that's for sure. Thank you all so much for joining me.
Thank you for having us
this afternoon. Appreciate that. Health City comes out every Monday, and the show is brought to you by Health City. It is Medical Mondays, and we talk about all sorts of things. And obviously, when we talk about cancers, we have to bring Miss Jennifer along.
Like a bad penny, I just keep turning up.
You're a good penny. You are a good penny. We're going to call you a good penny. So thank you so much, Shomari Scott and Jennifer Weber, as well as Dr. Deepak Varma. And thank you for all the great things you're doing out there, Dr. Deepak.
Thank you very much. Thank you, Catherine.
All right, so that's our show for today. Make sure you tune in tomorrow. It'll be Tuesday, Success 101. This is your Straight Talk Drive at 5 show. I am your host, Catherine Tyson. And you guys, I hope you've made it safely at home, or you're almost there. Have a great evening. We'll talk to you again tomorrow.
Connect to the culture.